So mother to child transmission was the term which was used. Nowadays it is actually, we try to avoid MTCT and we go more in favor of PTCT because the burden falls on the mother. So mother to child transmission. So it is like only the mother is transmitting the infection to the child, not the other partner, that is the father. So try to use, as and when possible, try to use the term PTCT, not MTCT, right? So the transmission can occur anytime during pregnancy, labor, or during the breastfeeding. And of course, this parent to child transmission is the major chunk, that is 90% of all HIV infections in the children is actually when the during either the pregnancy or the labor or during the breastfeeding process. And the target MTCTs should be less than 5%, but it is a long way to go. Where now the MTCT rate in the latest, in 2020, there was around 27.4%. It is actually falling from 40.2% in 2010. Now it is only 27.4%, but still we have a long way to go to achieve the target MTCT of 5%. Okay. So now coming to the risk of HIV transmission through MTCT or through PTCT. So we always refer to this particular tabular column whenever we counsel mothers, whenever we counsel the family regarding the feeding pattern, how to establish the feeding pattern and how important it is to give the ARV prophylaxis to the baby. So if there is no antiretroviral prophylaxis and the baby is on breastfeeding, that is the highest risk of transmission. That is 30 to 45%. There is a risk that the baby will acquire the infection during the PTCT. If there is no ARV and no breastfeeding, the risk can come up to 20%. In case the mother is on antiretroviral drug, the baby is on antiretroviral prophylaxis, and there is no breastfeeding, the risk can be terribly, very fortunately also can be decreased to 1%. But still, in India, we do not do the exclusive replacement feeding still because parents, family is not able to afford the exclusive replacement feeding. So we advise the mother to take the antiretroviral drugs. The baby is started on antiretroviral prophylaxis and continued on breastfeeding. The risk is only 2%. Okay, so it is not just the feeding which matters here, not just the mode of feeding that matters most here. It is also about the prophylaxis and the antiretroviral therapy that the mother should strictly adhere to. Okay, so remember this tableau. You can remember 2 or 3 percentages which will help you, right? So these 3 or 4 percentages you can definitely remember, I'm sure.